Thank you, Dr. Sullivan. Our next witness is Ms. Polly Tommey. Ms. Tommey is the director of Children's Health Defense TV and is an internationally recognized health freedom advocate, filmmaker, and author. She is here today to talk about her son, Billy. Ms. Tommey.
My son Billy entered the world as a healthy, perfect baby with an APGAR score that reflected his perfection. We followed every wellness check, every vaccination schedule, believing in the system that promised our child safety. For his entire first year, Billy thrived, meeting milestones, crawling, babbling, growing. Yet everything changed at 13 months, the day he received the MMR vaccine, the only one on the schedule back then. That day, I walked into the doctor's office, trusting the advice of professionals who emphasized the importance of vaccinating against deadly diseases like measles. Billy had just finished a round of antibiotics, but the nurse reassured me that the MMR vaccine was essential. Like any diligent parent, I followed these instructions. Hours after the vaccination, Billy's perfect world shattered. He became lethargic, sleeping for long stretches. When my husband came home that afternoon and went to check on him, Billy was convulsing, his tiny body gripped by seizures. We rushed him to hospital, desperate for answers, but the doctors, after hearing he'd had the MMR, said, "It's perfectly normal, it's perfectly common. Lots of children have seizures. He'll be fine. Antibiotics, Tylenol, he'll be fine." But he wasn't fine, and he's still not fine, age 29. He's severely sick with severe autism. We made the movie Vaxxed to try and understand and warn the world about the real dangers of the MMR vaccine. I even vaccinated my child after I had Billy because I was so pro-vaccine and so into the system. Just the MMR was the problem. But then we got out on the bus. We took a bus and we traveled around America, listening to parents around America, what had happened to them when they vaccinated their children. And what we saw was utterly horrific. We saw so much death following baby vaccines. These parents would vaccinate their perfectly healthy child, and then their child would die. We saw a video at the beginning of this about the whooping cough. I've interviewed so many parents, and one comes to mind, Carrie Bundy's baby. At 4 months old, she pleaded with the doctor, "Should I vaccinate my child? He's premature." "Oh, yes," said the pediatrician. "If you don't vaccinate your baby, he could die of whooping cough." She vaccinated that baby, and he was dead in his crib following that. That is the same story we hear over and over again. These childhood vaccinations, the people of America are telling us they are not safe and effective. We are seriously concerned at Children's Health Defense about the disinformation and misinformation out there, being told these vaccines are safety trialed, the safety studies are so good. Yet all we see is death and destruction over and over again. Babies, teenagers, HPV Gardasil, their ovaries are shutting down. They cannot have children anymore. The parents are reporting paralysis. Children paralyzed from the waist down. You shout out about polio to us. I have never seen so many crippled children around America. So many children in wheelchairs, unable to walk, talk, speak, on ventilation. Parents are trying to tell their story while putting a feeding tube down their child's to bleed out the lungs, bring out the lungs, while they're trying to tell us what has happened. Two little 2-year-olds who can't hold their heads up because they had one Hep B vaccine. And then you shout out about measles to us. Those 2 girls in Gaines County, they did not die of measles. Children's Health Defense have seen the medical records. We have had experts break down. Yet still, I sit here and I hear over and over again that those 2 girls died of measles. They did not die of measles. And yet, the press and others consistently shout out that vaccines are safe and effective. They are, vaccinate your family. We all vaccinated our families. Everybody sitting here, bar 2, vaccinated their families with catastrophic results. Over 12,000 signatures on those 2 buses of death, death, death. When will enough be enough? How many more buses? How many more children killed? How many more injured adults? And here's a question for you, the senators. Who is going to look after our children when we, the parents, are no longer around? That can't use a toilet, that will never date. All those things Dr. Hooker said. Our children are trapped at 29, 30 years old. They will never pay taxes. They need 24-hour care because of one vaccine, one moment in time. This is a national crisis that must be addressed. And I want to thank Senator Johnson and his team for giving us this day that we thought would never come, that the world could hear really and truly what happened to the people of America who are broken. And this doesn't just affect the person with the injury, by the way. It affects the siblings. It affects the extended family. One of us has to be a carer for life. So this has to stop. And we implore you, please, to follow us at children's health events, at least break down the truth and get to the truth behind the science of what is really happening. No more Pfizer-sponsored science. We need independent science, and we need our pediatricians to stop getting bonuses for vaccinating our children. So thank you to Senator Johnson and his team.
Thank you, Ms. Tommy. Our next witness is Ms. Cerise Murata. Ms. Murata is the Deputy Chief Executive Officer of Vaccinate Your Family, a national nonprofit. She's here today to talk about her son, Joseph. Ms. Murata.
Thank you. Hello, my name is Cerise Murata, and I am a mother who lost my child to a vaccine-preventable disease. Thank you for allowing me to be here today and share my story. In 2009, my 5-year-old son, Joseph, was a healthy kindergartner. He was a typical little boy who loved Star Wars and Spider-Man. As a family, we enjoyed playing board games and building puzzles. Joseph was smart, funny, and inquisitive. Simply put, he was one of the joys of my life. I was a protective mother, and like other parents, I always tried my best to keep my children safe. To be honest, the thought of losing a child to a vaccine-preventable disease never occurred to me. At the time, I incorrectly thought that these diseases were a thing of the past, until I lost my son Joseph to flu during the H1N1 pandemic in October 2009. This is a picture of Joseph. The H1N1 flu vaccine that could have saved his life was not available in our community until 2 weeks after he died. Joseph was one of 288 children who died during the 2009-2010 flu season, and one of over 2,700 children who have died from flu since 2004. Just this past flu season, 260 children have died from flu. And that's just flu. Right now, because of declining immunization rates, we have outbreaks of measles and pertussis. Due to mis- and disinformation, lack of access, anti-science sentiment, and other factors, Americans are continuing to die from diseases we have the tools to prevent. Parents continue to bury their children. We know from history what will happen if these trends continue. There is no acceptable loss when it comes to a child. Let me briefly share how my life has changed since losing Joseph. It was incredibly devastating to watch my child die in front of me in an ICU room. It was incredibly hard to go home that morning and tell his 7-year-old sister that her little brother wasn't ever coming home. Let me share what it felt like to walk into the funeral home, holding my daughter's hand and preparing her to see Joseph laying in a small coffin. Let me share how unbearable it was to stand in line at the county clinic to get my daughter her H1N1 vaccine, a vaccine that could possibly have saved Joseph's life. Let me share how incredibly painful it has been for my family each and every day to remember that Joseph will never graduate college, get married, or have a chance to contribute to society. Let me share how my heart breaks over and over and over again because he is no longer here. Now multiply that by thousands of other parents who have lost a child to a vaccine-preventable disease over the years, and the thousands more that are at risk if people don't have access to science-based, factual information about vaccines, vaccine safety, and vaccination services. Sadly, Joseph's story is not unique. I personally know many other parents who have lost their children. Maureen lost her 2-year-old son, JJ, to flu. Katie lost her infant, Callie, to whooping cough. Nicole lost her 10-year-old daughter, Teresa, to COVID-19. There are survivors, too, like Tamika, who had cervical cancer before the HPV vaccine was available. The list goes on. These families are just a few examples of the real impacts of these diseases. According to the CDC, about 4 million deaths worldwide are prevented by childhood vaccinations every year. Vaccines undergo extensive safety testing in clinical trials before they are approved for use, and the U.S. has robust safety monitoring systems to make sure these vaccines continue to be safe and effective following approval. I want to close today by acknowledging that my story and experiences do not in any way minimize those of my fellow witnesses. We are all doing the best we can with the information we have. But I would be remiss if I did not remind the committee that the science is clear. Vaccines are safe and effective. Without these life-saving tools, our families and communities are at risk. Thank you.
Thank you, Ms. Murata. Our final witness is Ms. Crystal Cordingley. Ms. Cordingley is a published scientist with over 20 years of experience in the medical field. She's here today to talk about her son, Corbin. Ms. Cordingley.
Chairman Johnson, Ranking Member Blumenthal, and members of the subcommittee, thank you for the opportunity to share my story, the story of how our lives were shattered in an instant and the nightmare we now live every day. My name is Crystal Cordingley. I'm a mother of 5, and this is about my son, Corbin D. Cordingley. He was born on September 2nd, 2012, healthy, vibrant, and perfect. He hit all of his milestones early and was a bright, loving, and busy little boy. Our life before his death was full of love, joy, and innocence. I am a scientist and fully believed in the safety and effectiveness of vaccines. I never questioned them. I thought I was protecting my children by following the CDC's vaccination schedule. Corbin received all of his routine vaccines on time, including his 12-month shots 43 days prior to his death. On October 18th, 2013, I took him in for a combo flu shot that would be administered in 2 doses. He seemed fully recovered from a recent cold, and it was a normal day. I fed my kids lunch, prepped dinner, and left for an evening shift at the hospital. That afternoon was the last time I would see my baby alive. At 8:30 p.m., my husband gave the kids a bath and rocked Corbin to sleep. He laid him in his crib, safe and sound. When I came home from work at 11:45 p.m., I went to nurse him. What I found haunts me to this day. My baby, face down. Fists clenched, arms stiff straight to his side, body stiff and unresponsive. I screamed for my husband to call 911 and immediately started CPR. When I opened his mouth, his tongue was stiff with rigor mortis and his lungs gurgled with broken down lung fluid as I tried to breathe life back into him. I knew. The paramedics arrived within minutes, but it was too late. At the hospital, after what felt like a lifetime of trying to revive him, the ER doctor called time of death. My world shattered. How could this happen? He was healthy. Nothing else was different that day, except the flu shot. I repeated it over and over to every medical professional. He got his flu shot this morning, but no one would ever consider it. I was brushed off, told it couldn't have been the vaccine. I was gaslit into believing some babies just die. But no, they don't. Not like this. I held my son's foot in the hospital until it went cold in my hand. Do you know what it's like to hold your lifeless child until their body goes cold? I prayed so hard he'd wake up that I became physically ill. His lung fluid soaked my jacket, and I've never been able to wash it. It's still in his laundry basket, along with all his other dirty clothes, untouched. Days later, I called to cancel his follow-up flu shot and told the pediatrician Corbin had died. Her immediate response was, "I don't believe the shot had anything to do with it." The medical examiner said the same, even after I asked her to send out testing. A month later, she admitted she forgot. When she finally did send tests, none of them had anything to do with determining whether the flu shot played a role in his death. Still searching for answers, we did every genetic test available. Myself, my husband, and our daughter. All clear. 2 years later, I submitted Corbin to a research study. They tested his brainstem and hippocampus. The lead researcher called me personally shocked. She said the damage and scarring she saw was typical in Sid's cases, but Corbin wasn't an infant. He was 13 months old, and he was perfectly healthy. Damage, not defects, not abnormalities, damage to his brain. Despite the pediatrician denying the vaccine's role to my face, I found a note in Corbin's records that she had filed a VAERS report just days after his death. She never told me. The report said, "The parents will not be contacted." She also suggested I continue vaccinating my other children and offered hospital observation after each dose. Why offer observation if vaccines are safe? I was never given informed consent. I was never told about the lack of long-term safety studies. I was never told about the ingredients like polysorbate 80 or the fact that true placebos were never used in many vaccine trials. I was given a simple sheet saying to expect a fever and use Tylenol. I wish someone had warned me. I wish I had been told to research the vaccine inserts, to look deeper, to look at the history, the true history. I wish I had the chance to fight for his life in the hospital, or given any kind of chance. I speak today not only to honor Corbin's memory, but to urge you to ask the hard questions. Parents deserve the truth. We deserve real informed consent, because no parent should have to live the nightmare I do. To all the parents listening, you can never unvaccinate, but you can wait. Wait until it's truly proven safe. One shot, one decision, one moment. That's all it takes to shatter a family forever. Thank you.
Thank you, Ms. Cordingley. I want to thank all the witnesses. I know telling your stories is not easy. I think I speak for everybody in this room, committee members. Our sincere condolences for your losses, for the tragedies that have really impacted your life. The divide here is wide. I don't doubt any of these stories. I don't. Where are vaccines useful? Where have they prevented death and disease? My guess is they have. But I also know that vaccine injuries are real. As I said at the onset, and they've been ignored. From both sides, we've heard misinformation. I mean, it's a weaponized word.
At the Y, your goals are our mission. Join in September and pay no joining fee. Plus,
as much, if not more, research into this area as anybody. Can you just comment on anything you've heard? And again, I don't want to make this contentious. I mean, you've all suffered horrible loss and tragedy, but this is a discussion. This is a debate. These are truths we have to seek out. So, Dr. Hooker, can you just, I'm just going to let you comment on things that may have struck you that you want to comment on.
You know, we've heard over and over and over again industry canards and, you know, things that are cringeworthy to me as a parent and as a scientist. The preponderance of evidence around vaccines and autism basically in the United States consists of 2 studies that were done by a flawed and fraudulent CDC, one on thimerosal-containing vaccines and one on the MMR vaccine. Clearly, in the MMR study, when you look at the table, it shows a statistically significant effect of the MMR when given on time. 67% more boys getting the vaccine on time get autism diagnosis than those that merely wait until 3 years of age. Now, I had a whistleblower come forward to me to tell this information, Dr. William Thompson, in 2013 and 2014. We also know that the Verstraeten study in 2003 is also flawed, fraught with errors, and fraudulent, accusing them of directly cherry-picking information from the vaccine safety data link because of issues with clinics. Now, there is a hole in the science around vaccines and autism that you can drive a Mack truck through. You can't just look at one vaccine and one component and then wave your pixie dust and say they're safe. That is just not a fact, and that is just not how science works.
Dr. Hooker, you mentioned Bill Thompson, and he was featured in the first movie, Vaxxed. Can you tell the story about that particular MMR study that I think identified a link between autism and MMR in Black young men, right?
That is correct.
Tell about the story about the CDC officials that gathered with their data, and was it a shredder? Tell about the story of them coming together and destroying the evidence, but Dr. Thompson did not do so.
Dr. Thompson did not do so.
Tell the story, though.
I will, yes. The CDC scientist who was the lead epidemiologist on this MMR study was Dr. William Thompson. He came forward to me in 2013 through a series of phone calls, and we were in close contact for 10 months. What happened was he found the African-American effect, that African-Americans were over 200% more likely, and African-American males over 300% more likely to get an autism diagnosis if they got the MMR vaccine on time versus if they were received the vaccine after 3 years of age. And when they got that evidence, when they got that information, they were told directly by the supervisors on the study, the same supervisors who were the co-authors of the Agent Orange.
Oh, wait, go ahead and name names.
Yes, Dr. Colleen Boyle and Dr. Frank DiStefano, they were ordered directly to destroy evidence and destroy federal records in violation of the Federal Records Act as amended in September of 2002. That information was destroyed. Dr. Thompson shared that information with me directly. I repeated the analysis, did the exact same analysis, and I got the exact same result. African-American males, when they get the MMR on time, are 3.5 times more likely to get an autism diagnosis than if you wait simply until after 3 years.
So that would show a link. And again, I think
that is correct.
The important part of this story is not only that, but the fact that you had federal health agency officials destroy evidence of that fact. They gathered everybody in office, right? And they literally all brought the evidence and they destroyed it together, except for Dr. Thompson. He kept the evidence, correct?
That is correct.
Okay. Ms. Tarsal, as I said in the opening statement, Dr. Joel Walskog talked about just being abandoned. Can you talk about your experience following your daughter's tragedy?